In Europe and globally, what are the trends of fatty liver disease?
The data on fatty liver disease is not very robust, but it has been documented to be increasing very much since 1990. Right now, it's estimated that as many as 1 in 4 adults have non-alcoholic fatty liver disease, or NAFLD, and as many as 1 in 8 children. There's differences between different regions of the world, between different countries, and within those countries, but we're talking about a condition affecting almost a quarter of the world's population.
What are the key challenges to address this health issue?
There are many challenges to address fatty liver disease. One is raising awareness among the general population, but also raising awareness among clinicians and healthcare providers outside of the liver space. So more endocrinologists need to engage, specialists in obesity, even cardiologists. Any specialists, any comorbidities related to liver disease, those experts need to be aware. So the challenges are raising awareness both within the health system and outside of the health system. And then it's the prevention that needs to take place, but also the treatment, which right now the specific treatment for fatty liver disease is structured lifestyle interventions. There's no specific drug for fatty liver disease, or there are drugs for comorbidities. So another challenge is also drug development. And finally, the other challenge, and there are many challenges for fatty liver disease, is diagnostics. So we need to further develop and use more often non-invasive tests.
As a public health expert, what are your recommendations?
One of the main public health challenges is to improve the models of care, to make the patient care pathway more fluid, more patient-centered, a one-stop shop, so they're not moving around, coming back for many visits, but having a holistic, comprehensive care provided. The other big challenge is more of a top-down approach, going outside of the health system, trying to get fatty liver disease, NAFLD, NASH, into global documents. So we need this at the national level. We need it in the action plans of those working on diabetes, on obesity. We also need liver-specific plans, but we need fatty liver disease to be recognized as a public health challenge, and I would even say a major public health challenge.
Has the World Health Organization taken any measures to acknowledge and address the burden of non-alcoholic fatty liver disease?
To my knowledge, to date, the World Health Organization has not taken any concrete action to address NAFLD or NASH. It's not mentioned in any of their technical guidance. I don't see it anywhere on their website, and very little attention is given to the liver in general, apart from viral hepatitis B or C. So we really need WHO to include it along with the other major non-communicable diseases in their technical guidance, in their policy guidance, in their strategies, and in their goals.
There is a lack of public awareness about the link between obesity and liver disease. How can we change this?
This year, WHO Europe launched a report on obesity to show the health consequences or different health impacts related to obesity. And we know how closely it's linked with the non-alcoholic fatty liver disease, but also with other issues such as cancer. So one of the questions I was asked to talk about is the lack of awareness among the public with the link with obesity and liver diseases. Now I have to say, the awareness about the obesity and cancer is also not very good. We know that the link between smoking and cancer has a very good awareness. But compared to that, the link between obesity and cancer is very little. So this is not a challenge only for liver disease. This is a common challenge that where we have to create awareness among the public, among the policymakers, the link between obesity and different non-communicable diseases such as the liver disease and cancer. How should we change? I think we have to document the science in a very simple way and create infographics and bring it up in discussion in very simple terms repeatedly at scientific forums, policy discussions, education material, etc.
How can we address the lack of public awareness regarding the link between obesity and liver disease?
we know that documenting the burden of disease is one of the first steps we need to do within the WHO if it needs to be taken higher up. And having that data at national level, subnational level, how it is affected by different socioeconomic groups or different age and sex groups is going to be the fundamental first step.
Considering this, why is fatty liver disease receiving so little attention from the WHO?
My personal opinion that there is a reason why some diseases are getting more visibility compared to liver disease. For example, there are different resolutions adopted by the member state at World Health Assembly and at the UN General Assembly to tackle non-communicable diseases. And in those resolutions, initially there were 4 diseases. Now there are 5 diseases. They are cardiovascular disease, cancer, diabetes, chronic obstructive pulmonary lung disease, and mental health. And then it talks about other NCDs as a basket but doesn't go into specify them. So when you specify the disease as top 4, top 5, top 6, it gets higher visibility. And if liver disease is not on those specified lists, it doesn't get. It's a very simple answer, but in order to raise the awareness, create more momentum from WHO, we need a clear mandate, and that mandates come from member states.
What recommendations do you have to address those barriers?
The recommendation is to create this dialogue at national level, discuss with national health authorities and partners about the burden of liver disease, and then together more and more member states bringing it to the governing bodies of the organizations like WHO will eventually help you to raise this issue. But at the same time, it doesn't stop us documenting the burden, publishing the reports, and describing the burden in a comparable manner for other countries. So as WHO, we are ready to work with you to look at this very important issue and also the link with obesity, because none of the countries are on track to hold the rise of obesity, and obesity levels are going up. So it's highly likely liver diseases which are linked to obesity will also go up. So there is a close connection, and we need to work together with all the stakeholders to address this challenge.